Let's get an update on healthcare reform. The battle over reform in that industry now, of course, moving on to the Senate. The House passed its version on Saturday night, but just barely. The bill would require all Americans to get healthcare coverage. There would be a new government program that would compete with private insurers. And married couples making at least $1 million would pay higher taxes to fund the new programs. Now, before debate begins in the Senate, Majority Leader Harry Reid is searching for the magical 60 votes he needs to avoid a filibuster. So far, though, he does not have them. Analysts say if the debate drags on, the bill's future could be in doubt. All right, joining us right now, if the House bill ends up getting signed into law, which companies win and which lose? Well, joining us to talk about that is Jeff Kraws. He's CEO of Crystal Research Associates. So, Jeffrey, let's talk broadly to begin with. Which companies are going to benefit the most? Which are going to lose under health care reform, in your view?
Companies that have novel, innovative products are going to be the winners. So you can take some of the smaller companies out there, your Unilife Medical Solutions, your BioNiches, your Generexes, your CellSize.
And these are small market cap companies.
Your small market cap companies, Neuralstem. Companies that have got novel, differentiated technologies. BioNiche, like I said. Companies that are going to benefit on the grand scale, companies that are more household names, are your larger pharma companies and your generic companies. What you're going to do is you're going to implement 30 to 36 million people coming into the system that will now be theoretically utilizing prescription drugs at an increasing rate since they did not have coverage and insurance.
More demand here.
More demand. The government has mandated for pharma companies an $80 billion give back. $30 billion of that is going to be to fill that donut hole with Medicaid, Medicare, the $30 billion. But the bottom line is you're going to see increasing utilization of pharmaceutical products. Pharmaceutical products still are only less than 10 cents of every dollar spent on healthcare. So they are part of the answer, not part of the problem. There's nothing draconian in this plan going at drug companies, saying drug companies, you know, this is really bad for you.
Right.
Hey, Jeffrey, it's Adam. If I can just jump in here. You mentioned 36 million people that didn't have insurance coming into the market now. They'll be getting insurance from the government. So will the government be picking up that tab so that if you're a tenant healthcare operating a hospital, for example, now you're getting paid for services that you were giving away before? So in other words, you might actually be a winner. Is that fair to say?
That's fair to say, certainly. The people who are going to ultimately be paying that tab are the taxpayers, i.e. your viewers. The bill is ending up being a lot more costly than people thought it was going to be. And believe me, just like a remodeling job on your house, it's going to be a lot more expensive than even they've estimated. They're $1.2 trillion. They wanted to keep it at $900 billion. It's going to be more expensive than $1.2 trillion. And we are far from having a finalized plan, anything that's just going to cruise through. There are still many obstacles to this getting passed. And the longer it goes through, actually, the better it is for the citizens of America, because the more well thought out it's going to be.
Jeff, what about the health insurers? We've talked a lot about them recently. The valuation seen as cheaper names. Some big names have been moving into the health insurers because they think these companies can still make money over the next few years.
Well, the healthcare insurance, depending on whether the public option comes in, whether the government ends up selling against insurance companies or not, that's going to be a big bet to see whether the companies will actually be able to make money. Obviously, if you're trying to sell against the government's not in this to lose more money, so that's a very risky proposition. Also, you know, they're thinking about putting people in here with pre-existing conditions, so it's not going to be very easy for them.
Jeffrey, let me just ask you, though, are we jumping the gun here? Because you think there's going to be a lot of changes here before this ultimately gets done. So are we jumping the gun a little bit when we start looking at kind of who's going to be affected, winners, losers?
Well, I think we're jumping the gun a little bit, but no matter what happens, you know, with the way the bill is structured and where all the big push is, pharmaceutical companies are certainly going to stand to benefit. They've gotten more efficient. They've downsized. They're going to be downsizing more. They're still coming up with innovative medicines, and they're still less than 10 cents of every dollar spent on healthcare. So if you want to lower your overall healthcare bill, you're going to use more drugs because it's going to keep people from ending up in the hospital. As far as jumping the gun, yes, because there's a lot, you know, the first period of the hockey game's over. You've got 2 periods to play, and anything can happen. And certainly, there's going to be a lot of change. This bill's nowhere near getting passed, despite President Obama's enthusiasm. This is not close.
Hey, Jeffrey, Adam, just quickly, speaking of big cap pharma, some of these stocks flat on the year, and yet dividends like Bristol-Myers up around 5.5%. Is there an argument to be made for buying these right now?
I think there is a very good argument. It's a very good point. Back to your defensive play, pharmaceutical companies, the demand is going to be increasing certainly for the products, because no matter what happens, you're getting a huge surge as far as the people who are going to be able to utilize prescription drugs.
Right.
They're probably not going down from here. They're probably at their bottom. You've got the dividend yield, which is fairly safe, and you've got a more efficient company across the board in large cap pharma when new products do come onto the marketplace.
All right, we'll certainly watch the trade on those. Jeffrey Kraws, thank you so much. We appreciate it.